ANSWER.
Mhm.
A is for air and fresh air. N is for nutrition. S is for sun. W is water. E is exercise. R is rest.
Greetings. Welcome to Generational Health. My name is Lily Brinker, and I'm excited to have you come in and join us, the wellness community. We have a treat today, and it's going to be a little bit of a different introduction. So I started off, I have a wonderful person, which I have the pleasure of now interacting with and meeting and talking with. But someone else is going to share a little bit about her, and then we're going to come in together and start talking about wellness journey and what that looks like as far as generational health. So Ira, did I pronounce it right?
Aya.
Aya? Okay,
Mm-hmm.
So we're going to start and I'll have you do the introduction so people will know exactly about this amazing guest we have today on generational health.
Hello, greetings everyone. My name is Dr. Iroko Turu. I would like to introduce you to someone that is just simply wonderful. Her name is Dr. Marietta Thompson, but she goes by her spiritual name, Dr. Kamaraya. Dr. Nopoko, Salume Nopoko, Iororopa, but we call her Dr. No. Dr. No, board certified naturopathic doctor who specialized in the spine. She's a certified nutritionalist, a certified immunologist, a certified pranic healer, certified hospice care, and a certified lymphatic drainage specialist.
Wow.
She has been into a number of indigenous, she's very familiar in the herbs and studies in advanced indigenous herbs and natural healing and nutrition, taught by medical and naturopathic doctors, healers and herb experts, bushmen and bushwomen, and natural healers in the jungles of Honduras and in other countries. With over 30 years of experience, advanced skill in pain removal, and clinical body connection, along with specialized herbal nutrition. She diagnoses, treats, and helps reverse chronic conditions such as breast cancer, arthritis, heart disease, hypertension, obesity, and sports work related to her. I met her 7 years ago. I've been her assistant. I was in the process of getting a knee replacement, and I was told to come see her first. Well, make a long story short, 6 years later, no knee replacement still, and I'm able to do a full squat.
Wow.
Being with her over the last 7 years, I have witnessed her take people from 4th stage cancer to no cancer when they follow her instructions. I have witnessed her fixing people's shoulders that are about to go into surgery. One young man came in to get a hip replacement on the way into surgery. Well, she was within 90 minutes, no hip replacement. I've seen her do this time and time again with many testimonials, and people just feeling really wonderful about it. So I would like to simply introduce you to, as I call her, Dr. No.
That was an amazing introduction. Amazing. I mean, you're doing the work. You're actually making it happen. I mean, how exciting. How exciting. Let's go back. So how did you start with the wellness journey, getting in, wanting to be a doctor, and the many other things that you've done? And I saw that you were connected to Dr. Sebi, which I'm intrigued by that. You're one of the people I've met that's actually had the connection with him. So one day you decided that I want to do these things, and I want to go into the community, and I want to do healing for the community. What came about?
Okay, well, it's all started. I'm a graduate of DePaul University here in Chicago. And I was looking for work and trying to find something when my degree was in marketing. However, I couldn't find a job in marketing. And in the process of working that out, I got ill. And someone told me, there's a doctor here in Chicago you need to go see. So I did. And when I saw him, he gave me a pack of herbs and I got well. I just couldn't believe I got well so quickly. And so I had a dream, and I told his doctor, I said, I'm coming back to see you because I had a dream. And in the dream, I respect my dreams because spirituality is really a big part of my life. And in this dream, it told me to go back and have an appointment with him and tell him you want to work for him. So I did what the spirit said do. I called over there and made an appointment with him, and Sebi was in town, and I told him my dream was to work for him. So he looked at me, he laughed and he smiled and he just walked away. And I was like, oh, he was very arrogant. I just said, okay, get that. 2 years later, Dr. Sebi called me and told me to meet him in Honduras.
Wow.
I had no other recourse but to get ready, and I left Chicago and I went to Honduras. I landed in San Pedro Sula because the airlines wouldn't stop in La Sabra because that's where he lived, in La Sabra, Honduras. And so I had to get back to La Sabra. So I got a chance to walk through the town and I asked anybody, I said, anybody know Senor Sebi? Because remember, I'm in a country that I don't speak the language and I'm new to this country. And I had to put together some Spanish words that I quite didn't know myself. But then somebody helped me out and told me how to reach his mother. So I did. I stayed with his mother and his auntie and his cousins for 2 weeks.
Wow.
And family, at that time, we didn't have cell phones. It was all the CBs that we use. And so they did a connection to him in the CB, and Sebi came to pick me up at his mom's house. And then I stayed with Sebi for almost 2 months. And once I stayed with him, I started walking through the mountains with him and learning about herbs and about healing. And so he told me, he said, you're here because you're ill and I want you to get well. So I need you to follow my program. And I did. And then once I did that, I started working for him. And I worked for him for over 15 years, selling Usha products.
Okay.
So after that, I was just going back and forth to the Uso Caliente village in Honduras. I made a point to go there at least 3 times a year and to spend time with Sebi and to learn more and more as I could about the healing that he talked about. So family, after that, I started selling the herbs and was pretty good at it, but I didn't know the medical language. And I told him, I said, I can't do this. I got to know what I'm doing. So I went to medical school. I stayed there 7 years. Came back to Sebi after 7 years with a doctoral degree as a naturopathic doctor. And that's how I got into the health field.
Now, with Dr. Sebi, basically, you said you learned the herbs. He taught you the different herbs and all that.
Yes.
Along the way,
yes.
and the healing. So what type of, he said that you were ill. What type of, was it just fatigue?
No. During that time, I had gotten pregnant, and what happened was I was 5 months pregnant, and in the hospital where I was at, they forgot I was in the waiting room and left me in the hallway with, after that I had the baby, they forgot I was there and left me in the hallway with afterbirth in my body and forgot all about me. Drugged me with Demerol, and my whole body became septic with infection. And
So wow.
I didn't have no other recourse at that point but to tell him about it. And he told me I needed to come to Honduras to do a complete full program with him. And that's what happened.
Were you able to nourish your baby at that time, or your body was just too
The baby died.
The baby died?
Yes. The baby died.
Wow.
And that's, and when I went to Honduras, he was able to clean my body up. I broke out.
And you had no understanding what was going on at all?
I had no understanding about the health field or healing, only for what my mother, we was raised in Argyle Gardens in Chicago, and she used to see a lot of people in the neighborhood for whatever reasons they were sick. They would come to my mother's house, Miss Greer's house, and she would do whatever she could with herbs. And I was familiar with herbs, but not Sebi's type of herbs. And so that was how I got basically involved in medical field.
So your body, I'm just going back to the baby. So did your body go into, it's shock, then you went into depression? Your body was going through a whole lot of different things.
Oh, my body, yeah, that's true. My body did go through quite a bit, but because being in that environment and Sebi helped me through all that. he kept making sure that I took the herbs. Sebi didn't just have herbs to clean your body. Sebi had herbs to mentally calm you down and balance the nervous system.
Oh.
And so therefore I was able to get through that time that was very difficult for me through his help.
Hmm.
And that's why I stayed at the village so long.
And you said for 15 years you were connected to him?
Oh, yeah. I've been connected with Sebi since 1984.
Okay.
And we were very good friends. And and after that occurred, I started selling the herbs, and I would just fly back and forth. And he would call me up and he said, he said, "What you doing?" I said, "I'm overwhelmed with clients, and I was working in the med field then." And he said, "Well, come," and I would come and stay at the Usa Caliente village, and that's how I really got connected with him.
Okay, so you were back to school, and so once you went back to school, were you able to practice at that time? You said you weren't able to practice, or you were to set up a clinic or set up a consultation?
Well, yeah, at that time, when I went back to school after leaving Sebi, I went to medical school, and then I stayed till I finished and got the doctoral degree. And I went back to Sebi and told him I'm now a doctor.
Running those clinics.
I also had, behind me, I ran at least 5 clinics in Chicago where I will work out of clinics, healing people. And I will work with all kind of patients, sick and all. I did a lot of PI, personal injury work, accident cases. And that brings me back to the nervous system because I had to understand the nervous system from C1 all the way to S5. So therefore, understanding the nervous system, I was able to bring those patients into balance and get those patients healed.
Okay, so how did you work around the allopathic system? Because you're bringing in a little bit of a different modality regarding healing. And then, and
Yes.
there's a whole, as you know, I'm telling you something you already know, but there's a whole system set up that says you do this to get this, to do this, to that. And you're coming in saying, well, there's another way for the body to reconnect with itself. And
absolutely.
So, you're at 5 clinics, 5 different clinics working. So go ahead.
Well, we have a lot of doctors, but they don't understand the nervous system. They don't understand C1 all the way to S5. You got to know where each one of those spinal nerves are wired out to. So they just, they give you what they call their own form of therapy. But I was able to go straight in because I understood that. And so I used what I knew to bring balance to the patients. And that this was something that was phenomenal with all the patients because they all got well. See, it was not just 1, 2, 3 coming to a clinic and getting therapy and then you get a check. No, we were healing these patients.
So the ones that the AMA, the American, they didn't come after you, bother you. I mean, you were to practice. I mean,
No.
they let you practice in the 5 clinics.
No.
Okay.
Oh, yeah. Neuropathy is not new. Neuropathy goes back to 1906. It's just that you don't see a lot of people in that field.
No.
Because a lot of people don't stay in the field because it's physical work. A lot of people don't want to do physical work. When I'm talking about physical work, that if some person come to me right now, I'm going to look at the spine all the way from C1. And most of the people can't even get to C1 because it's right up under the atlas as well as the axis of the head itself. They can't even get to it. And that is where the blood supply goes straight to the brain. When people have problems remembering things and they stay in a sympathetic nervous system, which is fight and flight, instead of coming back to the parasympathetic nervous system, which is rest and digest. So I was able to work through the nerves and go down every one of the vertebrae, one at a time, and bring them into alignment. And how we do that is through the spinous process, making sure the spinous process is in the place it's supposed to be, not going more antero than posterior, more medial than lateral, making sure it's where it's supposed to be. And once it's where it's supposed to be, then the nerve innervation can go out to supply the blood supply, the nerve supply, and lymphatic supply for the body.
Okay, so you're saying, and I don't, the language, you can correct me. So you're starting like the back of the head.
That's right.
Okay, so you're starting back there, and then that bone back there that kind of sticks out. So and on your neck. So that area right there from the beginning, I mean the back of the beginning and then down to that bone is where you're saying you're starting and you're going
Yeah.
down.
So with the bone that sticks out is C7. That's the one that you can actually visually see is
Right.
C7. Basically, if you don't know the spine, you will not be able to understand that C1, 2, 3 is for the brain. 4, 5, 6 is for the lower part of the body from the brain down.
Okay, and you're saying again, when that is, well, it's not damaged, but there's a problem, then the blood supply is cut off. So the blood
That's
supply,
right.
and you're not getting the blood supply to the brain.
That's right. That's why people have headaches. That's people delusion. They go in delusion. They don't remember things because there's not enough blood supply. That spinal nerve C1 is not in the place that it's supposed to be.
So a person wouldn't actually know that per
Yes.
se, unless they met with you.
No.
Okay. And then you said it's physical. So what are you doing physical to help put it back into alignment? These the spinal cord, the bones, whatever.
Well, the first thing I need to know what is going on with the patient. That comes with a consultation.
Okay.
What is happening? What is your problem? Where is your pain? And these things tell me what I need to do and what needs to be done for that patient. That's the first step. It's called consultation, examination, and treatment. So when they do a consult, they tell me about what's going on, why they feel this way, what's going on in the body. The nervous system affects every organ of the body, no matter where you are. The nervous system is connected all over you. You cannot move your hands, your fingers, your head. You couldn't walk. You couldn't talk. You couldn't do anything without the nervous system.
And so the damage sometimes, is it like sometimes from birth, or is it just wear and tear of life that we are? I mean, how does a person?
It could be both. It could be how they deliver the baby. It could be how the baby didn't develop properly. Or then it could be the wear and tear on how we daily have our daily lives or how we live our lives every day. Or are we doing something strenuous? Because sometimes you do something and you say, oh, I got a pain. You just threw a nerve off. You just threw one of the SPs off, or the spinous process off, or the transverse process is off, or that the vertebrae itself has rotated. So when I see the patient, they come to me, I can really detect what exactly is going on.
Amazing. That's amazing. Because I've never thought about per se in depth about the nervous system. You know, the spinal cord, yes. I mean, I end up working did some marketing for chiropractors, but you know, that's more go out, get people to come in. But the knowledge you're sharing is it's a little bit deeper.
Well, see, and I'm glad you said that because Lily, I make this a very, very big distinction. I am not a chiro. And I say this is because the chiros are not going to do what I do.
Okay.
You go in, you get popped, you get clicked, you make a noise, and then you 7 minutes, you're out the door.
Right.
No, that's not how I work. I'm examining your body. First, I'm doing your consult to see where the chief complaint is. And then once I do that, then I can go through the entire body. For one reaction really affects another reaction. Why? Because the vertebrae above will affect the vertebrae below. The vertebrae going to the east will affect the vertebrae going to the west. And so therefore, each one of these are connected. The whole spine and meninges, all is one complete unit. The brain, the central nervous system, and the peripheral nervous system, the spinal nerves, and the vertebrae are all one unit. It's not separate.
What I like is that, you know, in this system now, in the medical system, they outsource. You know, you got
That's right.
You know, and so you're not outsourcing. You're saying, no, we're dealing
No.
with the whole body at this point.
Yes, and so it's very important that if you understand, and I need you to really pay attention to this part I'm going to tell you, and that goes for every part of your body. Abnormal structure creates abnormal function of the heart.
Wow.
And therefore, If we rewire, remember that the nervous system is electric. The heart is electric. It's involuntarily beating every moment of the day. But if everything has to be wired by the spine, everything from your eyes to your cheeks to your nose to your vocal cords, your thyroid, your heart, your lungs, your bladder, your liver, your stomach, your pancreas, your spleen, your kidneys, everything is connected through the nervous system.
And wow.
Right. And there's so many operations that go on that's unnecessary. There's a lot of people going in for heart conditions when we need to just rewire the vertebrae, T5 through all the way 8, which will take care of the heart.
Is it a large people doing what you're doing, or is it a small group?
It's a small group because the school that was in Chicago is no longer here anymore. And the people that I went to school with, or the people that before me, they are either dead or they're gone, or it's just a very few population of people that do what I do. And there is a school, but not in the city of Chicago. It's in Mexico right now.
Wow.
New Mexico.
So how did you incorporate, you went into like with the studying the nervous system, but you also said lymphatic system.
Oh yeah, that's all part of it. Because see, once I graduated from school, I kept going to school. I never stopped.
Okay.
I'm always upgrading the process of learning. Mm-hmm. And we have to do that because we got so many pathologies out here that most people can't even pronounce.
Right.
That is occurring because food is different. People live in a different way now. People are under more stress. People have more toxins. People right now, they're going through so many different things that allows the body to break down. So I had to be aware of these things and be ready and prepared to take care of these patients and what it is that I'm looking at.
And so do you do the lymphatic drainage or
yes.
Okay. So you do,
yes.
So you combine those two, or they're separate?
Wherever I see it, I have been certified as lymphatic drainage. Yes. Specialist. Yes. And that, people with lymphedema, people who immune system is compromised, people who can't walk, or they have problems with breathing. All these things is part of the lymphatic system.
I have an aunt that talking about, but what is it? COPD? Am I pronouncing that correctly?
COPD, chronic obstructive pulmonary disease. Yes.
And so basically, they're of course they're on medication. And I just had another aunt basically who was on 7 blood pressure medications. The big trend now, if you notice around, is kidneys. There's kidney centers all over.
With the dialysis centers going up everywhere.
Yeah, everywhere. There's so many of those, and that we seem to be kind of like the target at this point of more of us going.
Well, I will agree to that, and then I will disagree to that. And I will agree to that. We are the target. However, the food is so bad that we need to wake up to see what it is that we're eating that we should not be eating, and that the food has been altered. The food is not the same that it was 10 years ago. And the next 10 years to come, I'm sure is not going to be as it is now. So therefore, we have to change our habits and work around trying to be healthy. It's not an easy task, but if it's a made up mind to be healthy, you definitely can be healthy.
So when we talk about the food being bad, are you talking about on the level of processed food?
I'm talking about processed food, all of it. It's not the same anymore.
Okay.
One of the things that I do here in Chicago, we make a point of, is go to the farm. I'm not really going to the grocery stores with the sprays and all the stuff they put on the food that has been genetically modified, GMO. And they know it. The food has been made in a laboratory. And by the way, I don't eat the animal.
Right.
I'm not interested.
And I was sharing with someone, and of course they pulled up some statistics. I mean, there's no way that amount of meat that we eat, that we have that amount of chickens and cows, and something is changing because it's a lot of meat and stuff that.
Oh yeah, it's a mystery with the numbers. I get it.
Here's the thing, like you're saying, we're at a point where like, okay, we're working these jobs and we're stressed out and McDonald's and, you know, you don't feel like cooking. So you go by, you know, quick, something's quick, whatever, you start your day. Because most people in general, as far as preparing a meal, we're pretty much out of touch with that. I'm not saying all, but I would say a large percentage. Are you able to educate people about the food?
Absolutely. Absolutely.
Okay.
This is what I study. I study every day, basically. This is one of the things that I feel is big time for me. It's called STD. And I'm not talking about sexually transmitted diseases.
What are you talking
I'm
about?
talking about stress, toxins, and deficiencies. That's what we live with in this day and time. Stress, toxins, and deficiencies. And this is what creates viruses and germs, and it causes spinal misalignment.
Understanding our bodies. I mean, most of us don't really understand. We're not really connected to our bodies. As long as it functions and does what it's supposed to do in our minds, we're fine with it. And when something goes wrong, or what we call wrong, then we're like at the mercy of, you know, going to the medical doctor and saying, "Can you fix me?" And then, you know, the pills start and all that, and then something else starts to decline and whatever. So what they say is, you know, that's part of aging. That's just part of life.
Well, that's not necessarily true, because the only, and I want you to hear me well when I tell you this, the only function of the body, the only function of this human body is to carry the mind.
Really?
Yes.
Carry the mind in the sense of, share a bit more about
Okay, let me explain that. You see, when people get sick,
that.
they don't make good decisions.
No.
The body, the function of the body itself helps the mind itself be healthy.
Okay.
If the body is not functioning at the level of just basically trying to live every day, then the mind is going to be affected by it. You see it every day. When you feel bad or you feel sick, you want to lay down. You don't want to think about nothing. You don't want to do anything. The brain is now in a state of let's rest. Let's rest. I don't want to do anything. I need this body to get healed, and then my mind will work better. And this is a quote that came from one of the books that my mom had. The only function of the body is to carry the mind.
To carry the mind.
Yes.
And so we have this thing that the function of the bodies are so many, we got so many other descriptions when it comes to the body. The purpose of our bodies is like a lot of different things at our mercy. You know, it does what we tell it to do. And like I said, when it doesn't, then, you know, it's, you know, you look good, you're in shape, you have all, it's all image. Everything with this like about sort of the image when it comes to the body along the way. And the mind, we don't think.
It still goes back to the mind.
Back to the mind.
Lily, it's going to go back to the mind. A sick body is not a well mind. A healthy body is a strong mind.
A strong mind. And so do you think that's why, I mean, you look at, and now we're saying we're having a lot of mental illness? Is that?
Yes. And you know, because I worked at a mental clinic for 5 years here in Chicago at Jackson Park Hospital. And one thing I do know, that when you bring a patient in that's mentally disturbed, the one thing they're going to do, first of all, is give that patient a physical.
Oh.
That's right.
Okay.
And once the physical part of their body fails, then they definitely going to go into the mind, because they find so many deficiencies. Remember, STD, stress, toxins, and deficiencies.
And that's done on purpose, basically.
That has been done on purpose. That is true. It's called depopulation.
And do you think that we've been targeted?
Of course.
Okay. I mean,
are you kidding?
Yeah.
Yes. Yeah. Every day.
Yeah. And but do you think in general that we, and I'm saying collectively, I know individually, that we are aware of it, or we're just kind of going along with the program?
Some of us are, some of us not. Some of us just go along with what they see. But there's people complaining all the time about what the food is tasting like, what it looks like, and it costs more.
Yes.
And if we think about it, if we think about 100% and we think about 98% of people that's not aware, 2% do know what's going on. And my partner and I, as well as you, are probably part of that 2%. You see?
Yes. Yes. I'm like you. Yes. I had a wake up call, but like you were saying about dreams and following, I call it my spirit guide, listening, because when things are not going a certain direction and I get this, I call it this message. I mean, I took the time to listen and, I want to know more. If I didn't,
That's
I'd
right.
be in another, down another path at this point. And I say to people, ask for guidance when you're confused. Before you go in for these treatments, for cancer treatments, ask for guidance before you do these things. But most of the
Absolutely.
time, people are in fear. They're in so much fear. I'm not going to make it. I'm whatever. I can't do that. And so they go into a fear part.
Well, I stayed in Miami because I opened a practice in Miami some years ago. And I had a sister come in to see me. And she told me, she said, I want to tell you a story. I said, okay. She said, my mom was diagnosed with cancer. And so they gave her chemo and radiation for the cancer. And her mom died, but she never believed it. She always had this question about it. So she had an autopsy done.
Oh, she did.
Her mom never had cancer. So what do you think she died of?
The treatment.
There you go.
The treatment.
And you know,
oh my goodness.
Understanding the world within your own self, Lily. The most neglected form of education is not understanding the house you live in, which is your body.
Right.
It is my objective to provide whole wellness, whole body wellness, and to educate and give understandings to my patients. Because we are living in a world that is compromising our health in so many ways every day. And so how do we manage our health? Most of us want longevity and we don't want just fads and trends. We want to understand some basic theologies of what we need to give us answers about our health. And it just happens to spell out the word answer itself, ANSWER. And I ask, even for the people who are listening to me, I'll ask them, how do you spell that word? Answer. ANSWER. A is for air and fresh air. N is for nutrition. S is for sun. W is water. E is exercise. R is rest.
I wrote that down. I'm going to have to borrow that one, okay?
And each body parts are connected to some form of emotions. And these emotional dramas that we have in our life can cause some form of disease eventually down the road. I have a beautiful spiritual connection to this primary organ system I want to share with you.
Okay.
And one is the heart, when we have heart trouble.
Yes.
Okay, heart. Someone broke your heart or you broke someone else's heart.
Oh, it's both ways.
Right? So listen, I'm going to go down the road.
Okay, go ahead.
Blood disease, family blood-related issues, lungs, sadness all the time, thyroids, not letting go of hurtful emotions, liver, resentment and anger, kidneys, always worrying about one thing or another, brain issues, looping the same thoughts over and over and over that cause a form of cells congregating together to cause tumors. Colon, you have a problem with holding on to the bad and not letting go of it. Spleen, personal relationships.
Wow.
And every day You come into contact with millions of outside germs and viruses that can linger on your body. And in the same case, they may make you sick. Personal hygiene helps. However, viruses and germs can alter the spine big time. And that's when we go into not STD as sexual transmitted disease, but stress, toxins, and deficiencies. And this causes spinal misalignments. When physical and metabolic changes happen in the body, it affects your aging and how you look and how well you age. And then the spine, whether you do something about the spine, is a good thing, but it has everything to do with your biological nutritional value. You see, Lily, nutrition is one of the keys to your biological longevity. The body was made to regenerate as long as we give it what it needs to survive. And so our subject, as we want to talk about today, is the nervous system. So let's talk about it. The nervous system has two anatomical divisions, the central nervous system and the peripheral. The central nervous system carries motor commands to the peripheral tissues. These divisions are responsible for recreating a harmonious internal and external environment. The central nervous system consists of the brain and the spinal cord. The central nervous system consists of connective tissues and blood vessels. And in both, the nervous system contains neurons and cells for intracellular communication. The central nervous system is a primary function to process, coordinate sensory data inside and out the body. It controls motor commands and activities of the musculoskeletal system. The peripheral nervous system delivers sensory information, and it all connects to the connective tissues and blood and vessels. And these chemicals are able to signal us and let us know there's a change in the body and that we need to do something about it. These signals have nerves, and we're going back to the spinal nerves. Okay. The spinal nerves have 33 vertebrae. The number 33 is sacred geometry. The number 33 have deep-rooted significance in spirituality and numerology. It symbolizes divine perfection. This is how the Creator made us. Your spine is divine perfection. When you turn 33, it is a period of intense spiritual awakening, profound transformation, and the alignment of one's life with deep purpose when you reach the age of 33. Now, this is where I come in. Open the energetic door. It's me. Ask me for a treatment, because I am going to treat your body and go through that sacred geometry and bring you into balance. Ask me about it. So therefore, I'm talking about it. What do I do when a patient comes to me when they get a treatment? Number one, I warm up the body by vibrating the body. The first thing I do is examine that spine, all the way from C1 to S5. Once I do that, then I'm checking once I examine the spine, I check for each one of those vertebrae one by one, making sure that the spinous process, the transverse process, and the foramen, which the spinal nerves exit out, are getting to the designated area, which is your organ system, for your organs to function properly. Once I examine the spine, then I'm opening up the highway of the body for the blood to flow all over. I check all the back. When I check the vertebrae, then I'm going to the lymphatic system, where I see that lymphatic drainage needs to take place. Okay. I check every one of those vertebrae again and making sure that the vertebrae that I fix are holding up and as stable. I check that vertebrae from anterow to posterior to medial to lateral. I check all the landmarks and also check all 33 vertebrae. Person comes to me, I make sure the shoulders, the elbows, the knees, the hips, the ankles, the tibia, the fibia, intero, postero, medial, lateral are in balance. Once patient is done with me, I put them on a wall. I tap the subclavian artery. And once I tap that subclavian artery, it sends blood all over the body to areas that the blood has not been able to reach. I do lymphatic drainage where if there's lymph nodes, I go up under the arms, making sure those lymph nodes are bust and are moving out of the body. And if a person has a problem with their breast, I do breast examinations. And I directly go to T3, which is the vertebrae that sends the spinal nerves to the breast. The other thing that I do if a problem comes with the larynx or the pharynx, then I go to that particular area, or the abdominal area, the stomach, the ribs, the intercostal muscles. All of that is part of the treatment. If spinal nerves are out of alignment properly or wired improperly, this creates damages to the spinal nerves. And that's why we call abnormal structure creates abnormal function. When these abnormal structures occur, various pathologies occurs in the spine, such as the disc shrinks. And when the disc shrinks, that means the patient is not drinking enough water. Or a protruding disc, too much acid in the food, creating a problem with a protruding disc. The disc itself has been filled with acid. Stenosis, that is the closing of the foramen, which is a hole in the spinal column, not allowing the full spinal nerves to innervate the organ system. How do I work with this? I work with car accidents, people in paralysis, people who have spinal nerve damages, and also the paraspinal muscles that are in rotation, the PSIS, which is the posterior superior iliac spine, which is out of balance, which causes a lot of pain in the lower back. And the other side of it is called, and the back is the posterior of the back, the front of the body is the ASIS, which is anterior superior iliac spine. I make sure all of those areas are in alignment.
Wow.
Also, the sacrum. If the sacrum is not in alignment, it throws the whole spinal column off and is out of order. The entire vertebrae is out of order and out of harmony. And that's why we refer to vertebrospinal nerve chart. Is when we look at this nerve chart that I have, you can see me, that I always go from C1 all the way to the coccygeal at the end, and each one of them have a specific job that they're wired out to do. C1 is going to the top of the head. C2 is the eyes and the nerves, the auditory nerves, the sinuses, the mastoid bones, the tongue, and the forehead. C3 is the cheeks. C4 is the nose, lips, and the mouth. C5 is the vocal cords. C6 is the neck and the muscles and the shoulders and the tonsils. C7 is the thyroid and the shoulders and elbow. And T1, and if you don't want me to go on, I can, because T2 is the heart, T3 is the lungs, T4 is the gallbladder, T5 is the liver and the solo complex plexus of the stomach, and then C6 is the stomach, C7 is the pancreas, C8 is the spleen, T9 is adrenals, T10 is the kidneys, T11 is the kidneys and the urethra, and also T12, the small intestines, L1, large intestines, L2, appendix, L3, sex organs, L4, the prostate gland, the muscles of the lower back and the sciatic nerve, L5, lower legs, arteries, ankles, and feet, the sacrum, hip bone, and the buttocks and the coccygeals and rectum. Just name them all for you. And so For me, I've been studying it so long. So when a patient comes to me, like I had a patient on one of my partner, he came and he said, "Oh, something wrong with my wrist. I can't move it, and I can't move my fingers." I said, "Well, we need to go to C7." But C7 was already off before the injury actually occurred. If that C7 was in place, then the injury would have never occurred.
Okay.
So when the injury occurred, I saw that C7 was off. I put C7 back in place and made sure that the nerve coming from C7 went straight to his wrist and brought that wrist back to balance.
It came back. He was able to move it once you
Yes,
did.
ma'am.
What is the one where the person I've seen in young people, where their body, they start to bend over?
It's called kyphonic. And we have three different things I want to bring, and it brings me right into, you right on target with what I want to say about that. They call spinal pathologies. One is scoliosis with an S curve, and two is lordotic where everything is moving forward, and then kyphonic when they have a hump in the back. That's called kyphonic.
So,
And other common conditions are obesities and all of that has too much weight on the back and the knees and the ankles. These also cause spinal problems.
really?
The spine itself is pulsating. It has its own energy field. It's a life force. It all works to your advantage as long as you take care of yourself. And when I go back to this sacred geometry that goes from the spiritual world, we understand when patients are suffering from a lack of vitality, it's coming from the spine that is misaligned. That's why they don't have no energy. The patient has chronic fatigue. They create stagnation in the nervous system. The patient loses energy throughout the spine, and he also has pain.
So the thing is, like with people, and instance, a woman I know, she's an elderly woman, she's starting to fall a lot. So they're saying, well,
Yes.
she's losing muscle mass. That's what she's been told. But you're going to
Well,
go back.
that could be part of the problem. But the spine holds up the body
Okay.
all the way from the bottom of the spine to the top of the spine. And if that spine is not in alignment, then she's going to be off balance. So that's part of the imbalancing that's going on with her. I mean, there's many other things going on, and we can't really detect it till we see the patient themselves. And we also know, and in my practice, it's definitely no one size fit all. No. Everybody is different. Everybody's different. Oh yeah, and I had this one patient that came. A medical doctor referred her to me because he couldn't do nothing with her. She she got all messed up. Her fingers were all locked. Her elbows was locked. She would drag her feet. Her whole body was taut, all completely out of balance, out of alignment. And and when you saw her, it was locked. And when he sent her to me, I just looked at her. I was like, well, it's going to take a minute, but we're going to take care of you. Only you need to do is just make sure you get to see me 3 times a week. And she did. We got her, and I asked her before we even started working on her, I asked her, I said, what is your goal? What do you want to do? She said, I want to be a Mantu dancer. She could hardly walk. She was dragging her feet. She couldn't hear me talk. She was just all messed up. And I looked at her. She said, I want to be a Mantu dancer. That's one of the big dance groups here in Chicago.
Okay.
Her dream was fulfilled.
Wow.
She invited me to a show, and she was in the show, and she was dancing with the Mantu dancers.
Oh, that's a wonderful story. The outcome again. The other side had given up on her, which means most of the time
That's right.
that's our. We think that's our lifesaver, and then you
That's right.
do her real lifesaver, and she had to do it at least 3 times a week. Come in, and so a lot of things, like you said, then is being misdiagnosed because the other things, like with the hands, you were saying to your partner with the hands, people say, well, he's got blood issues, but it'll be like high blood pressure. They would put all of the other things inside of that instead of dealing with the spinal cord.
Yes. And remember that anytime a bone is off and is not in alignment, it creates inflammation. Therefore, that the lady that you're speaking about, she's inflamed in the area where she has pain because that bone been off. Those bones, I won't just say a bone, many bones are out of alignment, creating inflammation that makes it difficult for her to walk. And every time she makes a step, it's painful.
To balance more difficult. It's almost like the wind comes along. It can almost like blow her over, and the balance is not there in general. So
again, I had this patient that came, and he was getting ready to get a hip replacement, and somebody sent him to me. And when I got through with him, he started moving his hip, and he was supposed to go for a hip replacement that following week. He never had to have that.
Wow.
He never had to have that. And also, Lily, I wanted to say, when you go back to the spiritual aspect, the vertebrae has a high vibratory frequency. And that frequency is spiritual. The health of every vertebrae in the body operates on a high vibratory frequency. And the reality of this, you feel, is a direct reflection of your vibration, whether it's high or low. It all goes back to the spine and the spinal cord. It's the antennas of the body. When the frequency is low and a bad diet, no exercise, poor water intake, increased stress, increased stagnation of the metabolic waste, your frequency is in disharmony. It's like an orchestra playing out of tune. And these energies become blocked. And chronic fatigue and pain occurs, which in turn accelerate the aging process.
Now, you had said earlier that, that you're not a meat eater. You had said that, correct? Am I correct?
No, I'm not.
What made you decide to become a non-meat eater? I mean, how far back does it go?
Oh, Dr. Sebi.
He wasn't a meat eater also? He didn't eat meat?
No, Dr. Sebi didn't eat animal at all. He convinced me not to eat it. And then I was such a lover of chicken, and I love chicken so much. I took a train from Chicago. I took an Amtrak train down to Forest, Mississippi, and I made an appointment to meet with the managers of the chicken coop so I could see for myself what was happening with the chicken, because I could get off of everything, but I couldn't get off the chicken. Right. But after visiting that area and the chicken coop and what they was doing, the process, I no longer ate chicken. I don't want it.
Wow. I'm not a meat eater either. I just wondered what made you decide to do
that. That's what happened. Yeah. Sebi encouraged me, but it was I still had that urge for it that wanted me to eat it. And finally, when I went down there to see it, I took the train by myself and made an appointment with the managers of the chicken coops, and so they could show me around, and they did just that. And when I came back, I was not wanting the chicken anymore.
Yeah, and a lot of it is the seasoning too. It's not the chicken; it's the
it's not the meat. All of it. Yeah. It's none of it. It's all what you put in it.
Yeah, it's with the seasoning, how they do that and everything. And then, for instance, for me, beef is heavy. It's always been heavy.
Oh yeah.
It just takes. I can feel it takes. Beef would be like having, and I like peanut butter, but beef is like having peanut butter in a sense. It stays there a lot longer. So it was what.
That's true. It go in and it's hard to get out.
It's hard to get out. It is hard to get out. So you also are an herbalist. You did herbalist?
Yes, I do. I provide, like when patients come, I will provide a program for them if they're very sick, and I will customize a herbal program. It's not one size fit all. Okay. I will customize that herbal program because I studied from my mom and also from Dr. Sebi and did my own research on herbs. And then I traveled a lot, and I stayed up in the mountains with bush women to learn more about herbs. I stayed in different countries in the mountains to understand healing from the perspective of people doing everything on a natural level. So that allowed me to come back and understand healing, going to med school, as well as understanding how to get people out of problems and pathologies.
So you provide herbs for your patients. You're
Yes.
not like a person online just selling herbs.
No. They're custom. I had a patient this past week that flew in from California. He had problems with the immune system. So the herbs that I made for him was focusing the main thing to boost his immune system. So yes.
I saw where if I'm a panic healer, did I get that right?
Pranic.
Pranic healer. I didn't read that correctly. What that means.
That means energy to heal. You just build up the energy within yourself. You transfer that energy over to them so that they can heal.
So you use your own
Sometimes
energy?
you touch them. Yes, and sometimes you don't. Sometimes you don't even have to touch them. You can do it. I can do it from the telephone right here and send the energy to them in another state.
Well, I'm gonna have to call you about that. Okay.
It's called pranic healing. The other part, to give you a little idea of what I did in medical school, was I was able to take an entire spine out the body and to examine that spine. This when I got to understand the vertebrae and how they were connected, because I was able to remove that from a cadaver and saved many people from hip replacements and knee replacements. And I rewired many patients with personal injuries, with car accidents and work-related injuries. I got over 20 people off of canes and other ones out of wheelchairs. I adjusted babies and children, as well as autistic children, and I also adjust cats and dogs.
Oh boy, okay. You got my attention.
I actually adjust when I go to Georgia. I adjust son's dog, and when I adjust him, he follows me around the house all day, and he sits on my feet all day because he wants an adjustment.
Oh, it feels so good to him.
He feels so good.
Oh my
It
goodness.
increases blood flow to the brain and it increases cognitive skills. Also, I work with weight loss and various pathologies to increase blood flow, increase synovial fluid, increase immune response, increase cerebrospinal fluid in the spine.
So with the blood flow, which also increases the oxygen flowing to the body.
Absolutely. I mean, that's another subject that I really want to get into, but I want to stay on this subject, which is the nervous system. And if you take the width of 3 fingers below the navel, it's 2 inches below the navel. This is called the sea of energy.
The sea of energy.
This is the body's main battery. And you can activate that when you're feeling low.
The navel, and then you take your finger, you put it inside the navel, or just
No. You got to hear me.
Okay.
2 inches below the navel.
2 inches below.
It's called the sea of energy.
Sea of energy. I'll write that.
This is the body's main battery. And you can activate it on days. And most people don't know how to do it. I'm the one that does it. I help people with that. But you can. I mean, I could definitely show you.
I'm interested in that. Yeah, the pranic healing and the sea of energy to find more. Yeah, I definitely am interested. Anything that's going to help us become more of our own health advocate, important to me, and for the wellness community for us, because we're disconnected.
See, the hidden vitality of energy is in your spine, and most people don't know that. The spine is not just a pile of bones stacked on the top of your back, on the back of your body.
Right.
The nervous system is like a tree that's upside down, where the brain being the root and the stem is the spinal nerves. And all the organs are all the root. So the spine is a superconductor through which the main current of your nerves has a powerful energy flow, Lily. The vital energy is hidden in the sacred code of the spine. Each vertebrae is a portal, a step in the journey of an energetic ascension. It is the dance of the living rivers ready to restore peace in your body. And this is important because I'm talking about the spine. And when you inhale deeply, you are not just filling your lungs. You are sending a surge of vital energy to each of the trillion of cells in your body, and especially the spine itself.
Just
It
by the
gives them
feeling.
fuel. It gives the spine itself fuel, which is needed to repair, regenerate, and function at its highest potential. A deep, full breath oxygenates your whole entire body. If you breathe poorly, your life is like a tasteless, unsalted soup, and you die before your time.
By the
This
breathing.
river breath
Mm.
needs a constant flow to stay clean and oxygenated and full of life. The object for me in treating is to remove energy blocks which assist currents over the nerves like wireless energy. Man's nervous system emanating from the brain as its roots is the source of the tree of life itself.
Wow.
Where, where is the starting point? Well, start with conscious movement, awakening the body's innate influence of vital energy where it is necessary to improve your needed vitality. This number 33 is a divine pattern in the microcosmic as well as the macrocosmic, connected to the spine, and the spine is connected to the planet Earth itself. The spine is a central force. It is an energy of life. It is the superconductor that generates energy. Again, it is hidden in a vitality energy, and this hidden energy is in your spine. It's not just a pile of bones stacked on the back of your body.
Mm-hmm.
Everyone deserves a great doctor that can take control of their health and make the informed choices that can help decrease disease or reverse them. A healthy diet, nutrition, exercise, consistent spinal treatments is key when the body is misaligned, when the body, especially the spine, is misaligned and creates connective tissue distress and nerve damage. Life must ever flow as a fountain from within and without. Remove energy blocks that blocks energy cannot pass through. Remember, each vertebrae is a portal connected to the planet Earth. You are as young as your spine.
Wow.
And as you move around doing your daily rituals, just think about me for a moment. Just think about how you can come to me and I can regenerate your body from head to toe. Take a moment. You can move, you can stand up, you can sit down, you can pick up your phone, you can listen to the sounds, you can read. While all of this is going on, your heart, your lungs, your kidneys, and other organs are doing their jobs, thanks to this wonderful system called the nervous system. Now, I know my time is at end right now, but I'm going to take a moment to reflect. I'd like for you to reflect on the power and the importance and the resiliency of the nervous system. Why? We can't move without it.
No, we can't. Powerful. Powerful. You have really educated me, and brought some things to light for me, and just listening to what you just shared. And I know the wellness community, this is information a lot of them are not aware of also. So what advice would you give people just taking care of the spine? Anything that you would suggest?
That is back to where we started from.
Yes.
Answer, ANSWER.
So
And then I also want to say that the nervous system and how you take care of your body all comes from nutrition. You have to make sure that every one of those vertebrae need the right type of nutrition. And we need to feed. Go ahead.
And then you went down the list and went from C down to T and whatever. So each one of them has a purpose and what that means.
That's right. That's right, because they all are connected and wired out to various areas in the body. And the Creator did a good job for us. He really did.
Oh, and that's our foundation. So the spinal cord is our foundation, basically.
It's phenomenal when you think about the spine and how the Creator created it.
Wow.
It's all in sections. The C's are all the cervicals, the T's is the thoracic, the L's is the lumbar, and the S is the sacrum. It's all in divine order, divine perfection. So, what I do now, Lily, I mean, people do call me and they say, well, do you want to come to this city or do you want to come to this state? They fly me in. I will see, they have at least 15 to 20 patients for me. I will treat them. I will do a workshop for them and get people well.
Thank you. Give us your contact information and then your hours of operation too.
My phone number is 773-236-6268. Basically, I'm working from 8 to 5, depending on the patients.
And you're in the Chicago area?
Yes, I'm in Chicago area.
Okay. And so are you, what side are you on, the south side of Chicago? What area are you?
I'm on the south side of Chicago.
Okay. And there's easy access to you, basically?
Oh, yes, definitely.
Definitely. And you've been doing this, like I said, and you had 5 clinics at one point. You're down to 1 clinic now, or?
Well, I'm not even in the clinics. It's too much work for me. I just do private work now.
Oh, okay. You're private. That makes sense. So are you booked way out, or can people, what they call, kind of?
Yes, but you have to call and set it up, and then depends on what's going on.
You're 2 hours ahead of us. So, anything else you want to share before we close?
I actually, what they call me here in Chicago.
What?
You know what they call me?
What they call you?
The master body mechanic.
Oh, I like that. I like that.
They call me the master body mechanic. Like you got your car mechanic, they call me the body mechanic.
And you enjoy
basically
it.
I can't fix anything. I can basically fix whatever it is.
And you enjoy it.
Oh, I love it.
I mean, I can tell with the conversation and the smile.
I love it.
Yeah, you enjoy what you're doing. You can tell when you're speaking about it. That's right there is like an honor to have someone who really enjoys connecting with someone's body and working with it. Because
absolutely.
If you're motivated, I'm motivated, and it's like a team. Again, we're on that team. We're working together.
Absolutely, Lily.
Yeah, reconnect us back to our bodies, and that's what you're doing. You're reconnecting us. You're a tune-up. You're whatever. You're tuning us up.
That's right.
And getting us back out.
Absolutely.
And I thank you for coming on Generational Health. I do appreciate both your time and coming in and just talking about what you've done in the community and what you're still doing. I wish you a lot of love. I wish you light.
Same to you, Lily.
Thank you.
Thank you for inviting me.